Hi, and welcome to another edition of The Heart of the Jersey Shore. Today, we're happy to have Dr. Shane Capone. He's the owner of Activate Physical Therapy right here on Route 37 in Toms River. Thank you for being our guest today.
Thank you for having me.
I appreciate it. So, why did you want to become a physical therapist?
It's probably the number one question we get from patients. There's part of it that's a selfish answer, and then part of it that is the feel-good story. The selfish answer is I just didn't want to sit at a desk, and I didn't want to work a 9 to 5.
Don't blame you.
Yeah. The other side is I had a grandpa who raised me and lived with him up to when I was a senior in high school. He got very sick, came out of the hospital. His knee was very arthritic and he couldn't walk, couldn't even get up. We had a bi-level, so he couldn't get up the stairs. And he convinced the doctor to do a knee replacement on him, even though he really shouldn't have because he was pretty, had a lot of comorbidities. But he did it, and he did a lot of PT, and he got a good 7-8 years back of his life. He was driving, he was taking me places, we were going places together. So it was cool. I mean, he put in a lot of work, but it really gave another almost decade back to him when he was, on kind of death's door for a little while. So
that's incredible.
So part of both. It kind of just fell into my life right when I was a senior in high school, and that's what set me on the path.
That's a good story.
Yeah,
it's a good reason.
Absolutely, yeah.
So, where did you go to school? What certificates and degrees do you have? What put you here today?
Yeah, I went a long route for sure. So I started as a psychology major. I switched to physical education. Right when I was about to get my physical education degree, I changed my mind and went the biology way. But I finished the phys ed degree as well.
Okay.
Then I got a biology degree. And then the biology classes were the prerequisites for the physical therapy degree, which is a doctorate program now. So I did 3 full years of that, and took about 8 years, all said and done.
Wow.
So it was a long haul, but it's all worth it in the end.
Oh, I'm sure.
Yeah.
So how long have you technically been a physical therapist?
I started, I think it was 2014, so about 11 years. Yeah, but I've been in the PT field since 2010. I started as an aide and then went back to school, so about 14 years all said and done.
Is that the natural progression?
Some people, I would say probably 20% of my class were aides before, which I thought would be more, but that's what we try to do here. I try to get aides that are in PT, OT school that want to get into the field instead of just hiring John Smith that wants a job for a certain amount per hour.
But they want it for a real reason.
Yeah, they're trying to improve themselves, and it really sets you up to when they become a PT or OT that hopefully they had a good experience here, and then we don't have to go looking. They just come back, and it's a natural progression, kind of like keeping it in-house, in-family kind of thing. Yeah.
Promotions from within.
Yes, exactly. Yes.
Always good.
Yeah.
So I understand that you're now a chain.
Yeah, no, I wouldn't call us that.
a corporation.
Yeah.
How's that?
We have 2 offices right now. I had a partner at my old job who is actually my best friend from when we were 8 years old.
Wow.
And he came aboard about 4 or 5 months ago, and we opened a second location in Bayville. And we're looking, maybe to expand to one more in the near future. It's a lot when you're one man, but when you make it 2, you exponentially can do more. And if we can reach more people and give a good product to them, then that's our goal, right? It's to get as many people as we can. Our stance in the medical field is there's just so many chains and so many of the big box places. So you can either get that and you get the big place with the chain feel. With that comes you might not know who you're seeing on any given Monday or Wednesday or Friday. You might see 3 different therapists that you've never seen before. But the mom and pop shops are very difficult to open, right? So they might be really small and you're constrained by the space. So we really wanted to blend the 2, right? Because there's really nowhere that you can blend the nice big atmosphere and have all the space so you can fit everyone in, but also keep the mom and pop feel to it.
You worked for other companies before
I worked
you
for only
started
one
your
company.
own?
Yeah, one company from 2010 all the way up to 2022.
And you weren't happy working for
I wouldn't say that. I would just say they grew very well and fast, and it just got to the point where I could tell that I was, a part of their plan, but not on a level that I wanted to be, right? So
Right.
like I just wanted a little more. So had the aha moment when you just say, you know what, I could do this on my own and not have to run it through people when I want to do something or I have a
Right.
good idea or something like that. So it wasn't that it was a bad experience, it was just time.
It's always nice to be your own boss.
Absolutely, yeah.
Makes it easier.
Yeah.
So I noticed over there on the wall that there's a plaque stating that you were voted the best physical therapist 2022.
Yeah.
That's a great accomplishment.
Yeah, it was a surprise. I honestly didn't even know about the contest. Someone just sent it to me. They saw it on Instagram or something. I have a big community in Ocean County, a lot of friends. I moved around a lot as a kid, and in hindsight, it was a good thing because I met a lot of people. So a lot of people know I'm a PT now, and I think when the voting opened up, they were happy to put me in there. I think hopefully a lot of patients voted for me because of the experience they had. But even better, like in 2020, so that was 2022 when I was at another place. But last year, so we skipped 2023 because I wasn't quite open yet.
Right.
But 2024, as the mom and pop shop, we won the physical therapist office of the year in Ocean County.
Wow,
Yeah.
that's great.
Which is even better because I like the team approach. PT is not about one person. You really need a good crew. So I'm more happy about the team winning. And then we're in the final 3 for this year again.
Wow,
So
great.
hopefully we'll do it 2 years in a row. And we're really like the little fish in the big pond because these places have 20, 30 offices. So
Right.
It was cool to win last year for sure. Everyone was really happy. So I was really proud of that one.
Well, I will say, in my lifetime and all of my calamities of life, I've been through many PT places, and you are definitely a standalone at the top of the rank as
I
far as I'm
appreciate it.
concerned.
Well, I'm happy you had that
There's
experience.
such a big difference here.
Good. Yeah, that's what we go for.
And like you said, it's definite teamwork.
Yeah.
It shows.
Yeah.
Every time you walk in the store, you see it.
Yeah, we have meetings every month, or we'll get lunch together. We had one yesterday, and they're probably tired of me saying this. Is there's change. There are certain things there's the high quality fast food place, and then there's you might see 100 of them, but they're not going to give you that same quality, right? Same thing, coffee shop, you name it, clothing store.
Right.
We want to be of that high quality, which means doing a lot of the extra stuff, right? I know, and I tell these people when we do the interviews for the job, you're going to work very hard, right? But it's going to be fun, right? Work can be fun. We can have fun helping
Absolutely.
people, and everyone has ascribed to that. And we've had a couple that haven't been, and they kind of weed themselves out because it's not an atmosphere that they want to be in.
Right.
So it has bred a lot of hardworking, winning people, and then it really transfers to the patient, and hopefully the energy uplifts people coming here in pain. So we want to make it a nice environment because you're coming in here hurting. So it's not always the most enjoyable thing to come in here. We know that, so that's our goal. So I'm glad you had a good experience.
You make it more of a homey type feel.
Good.
A welcoming feel.
Good.
Which is really important.
Absolutely.
It's so rare.
Yeah, it's the goal. So I'm glad it's coming across.
It is.
Yeah.
So what's the age range of patients that you draw?
Yeah, so 7 to 100. That's part of opening this business. Is I don't want to pigeonhole us, right? I don't want to. So a lot of people for a long time thought I just worked with athletes, right? They would, even local doctors, they'd be like, "Oh, you're the athlete PT." I'm like, no, I'm not the athlete PT. I will see athletes, and we see a ton of athletes, but I want mom and dad and aunt and uncle and grandma and grandpa, right? Because the athletes need to be pushed, no different than aunt and uncle or grandma and grandpa.
Right.
You just have to know where the line is, right? That's
Exactly.
kind of where the skill in PT comes. So I like working literally with everybody, right? And we have it here. It's awesome. In the morning, we might get the before work blue collar crew who's grinding, and they got to be to work by 8, and they come in here and they bang their stuff out, and we work on them, and then they get to work. And then we have the retirees during the late morning into early afternoon, and then the athletes come at night after school. So we have a good blend of people, which is exciting. It's always been my goal.
That's great.
Yeah.
So what are the main issues your senior patients face?
Low back pain is traditionally a big one for us. We see a lot of knee replacements. ACL is our specialty, our bread and butter. I've put hours and hours and hours of work and research and development into these protocols that we made for the ACL. So for athletic population, we're very known for that. But for everyone else, sciatica is a big one. Low back pain, shoulder pain, knee pain, hip pain. It's all over the place. Yeah, it's a little bit of everything. I would say low back pain and neck pain are probably the top two.
The top two.
Yeah.
Okay, so do you play any sports, and what precautions do you take personally?
It's a good question. I do. I try to stay as active as possible. These days, it's jiu-jitsu and surfing and just daily exercise are probably my top three things. I think it's the case of the painter's walls are never painted nicely, right? Mixed in with having a couple kids at home.
True.
I would love to have 3 hours to do PT and then work out and then do jiu-jitsu and then go home, but that's not true. So the one that falls off a lot is the self-care. But when I do get the time, I make sure, I shouldn't say that, because usually at least 3 to 5 days I'm watching TV at home and I'm stretching while I'm watching TV, or I'm doing mobility work, or I'm a big fan of, in PT, like the saying or the law of objects in motion stay in motion has come so true, right? So, and I'm aware of that. I see people who stop a lot of times, right when people retire and they stop moving so much and they break down. So I try to just keep moving. I'll move whenever I can. I'm never idle, right? I'm always doing something, coaching my son's team, moving around, working out, walking at the beach. So I just try to really stay as active as I can.
And you get quite a workout here.
We do, yeah. We're moving. That's probably the number 2 question, Gary. When people ask us how sore we are at the end of the night, you get used to it. But
I asked you that too.
You did, yeah. But at first, it's a learning curve. Your body has to adapt, because we're climbing on tables and lifting people's legs all day and stuff. So it's a good thing though for me. I like to be moving and doing more physical work rather than sitting.
That's great.
Yeah.
Could you explain what the method of RRP is?
Yeah, so RRP is really it goes to, repair, restore, prevent.
Okay.
We leave the P off in PT a ton, right? Whether it's because insurance cuts you off, or you just feel like, oh, I feel better now, I'm done. But you have to prevent, every injury is a gate, right? And the gate may have never been open, and now it's open, and it's a loose gate, right? So any injury you think of, low back pain, knee pain, whatever, is so likely to come back once you had it once. So we really try to, repair, you let the tissues repair, you have to protect whatever the injury is at the time. Restore, you get back anything that you lost when you had from before the injury.
Right.
Prevent is the big one, right? That's why we build out the office like this. That's why we have bigger weights, and that's why we use the empty space, because we work people, right? Like if you want to prevent an injury, you have to come up to the level of the task. So if you go to the supermarket and you're picking up a case of water that's maybe 12 pounds, but you haven't tried to lift a 10 to 15 pound weight in here, you're at risk for injury again, right? Wet clothes in a laundry basket can be 20, 25 pounds. So you got to carry that thing. So if your back per se is not ready for that, and we didn't do it in here, then we didn't do you justice, right? And that falls off a lot of times. I think we sometimes get scared as a profession to challenge people, and even the older generation.
Yeah.
I'll give an 85-year-old 25 pounds and let them carry it around, if they can do it, if it's appropriate. And a lot can, and they surprise themselves, and it's cool to watch their face light up. They're like, oh my God, I just carried 25 pounds for 100 feet. So that's the P is the most important for me.
Great. Are there any particular injuries that you like to rehab?
I really like the shoulder. The shoulder to me and would be a close second would probably be the knee. The shoulder's connected, the knee bone's connected to the hand bone kind of thing. The shoulder is really, it's not even really attached to our body. It's attached to a shoulder blade that floats kind of on the ribs. So it needs a lot of stability. It's really like you really have to be good with your assessment and figure out what's going on, and it really is connected to, we'll have to go down to the hip and the knee and the ankle and see if there's something mechanically that is messing up where your shoulder's sitting or your shoulder blade's sitting, and really like trace it back, and then form a plan from there. So we tell people, so they don't think we're crazy, is like, hey, I know it's your shoulder. If you're doing a hip exercise, it's just because it's connected. So I'd say the shoulder is probably my favorite.
Okay.
Yeah.
So what advice do you give people facing difficult rehab?
Yeah, time and effort always win, right? And if you put time and you put effort in, I'd say, I'm making numbers up, but I'd say 98% of people will get better, right? And if you don't, we notice, and that's, again, being a good clinician, you need to notice that, hey, Mark has been here 3 times a week for 12 weeks. He still has pain. Okay, something's wrong. That's when we have a good network of doctors that I can call and get our patients in like within a day a lot of times, which is good because orthopedics, you could be waiting weeks,
Yeah.
But hey, I can call Dr. So-and-so. I have Mark here. He's been here for 12 weeks. His back is still messed up. I think something's wrong here. Okay, send him over tomorrow, get the MRI, and then figure out what's really wrong. Because if there's not a big structural issue, like a blown out disc or a blown out rotator cuff, it'll get better with time and effort. So a lot of times it's slow it down, don't look for the quick results, don't look for the magic pill, and just be consistent.
Right.
Consistency always wins.
That's true.
Yeah.
So if anything, what could be done for acute sciatica?
The sciatica is a good one because it can be numerous things, right? It can be the spine where a disc is pressing on the nerve in the spine.
Right.
It could be on the back of the hip where a couple of the muscles can press on the sciatic nerve and send the same kind of symptoms down. And that's 2 of the reasons. So you really have to trace it back to what's the correct diagnosis, right? If you're treating the back, but it's really the hip, you could treat the back all you want, the sciatica is not going to go anywhere, and vice versa, same thing. So really getting a good idea of where the sciatica is coming from is key.
And what about neuropathy?
Yeah, so neuropathy is a very tough one because there is no treatment, right? There's the number one thing out there for neuropathy is exercise. Goes back to the objects in motion, right?
Okay.
Neuropathy, osteoarthritis, all these things are opportunistic. So like when you stop and the blood flow stops, it can set in, and it can set in fierce and quick, right? So movement, just keep moving, keep the blood flowing, keep the nerves nourished, keep the blood flow going through all the extremities, and that's going to get you your best feeling back. Because neuropathy can be painful, it can be frustrating because your balance can go,
Right.
So the key is getting neuropathy early and getting on a good exercise program as fast as you can.
And that would include walking, swimming,
Everything.
What?
You
Stretching,
name it. Any move you think of, I could
Just
say
a
yes.
movement.
There's no such thing as a bad movement. There's the wrong dosage, like too much too soon or something like that. But any movement is good for neuropathy. Like if you came in here with neuropathy, it would be a combination of strength, flexibility, and balance, because those are the 3 things that will go with neuropathy.
Right.
So we'll assess first, see which one you struggle with the most, and that will be the forefront, but we'll always keep the other 2, in the close second and third.
Right. Very good.
Yeah.
I also know that you do dry needling. Could you explain what that is?
Yeah, so dry needling is fairly new, especially to PTs. So you have to go and get a certification for it. New Jersey is very strict. They require a lot of hours, but basically you use acupuncture needles. We use the same needles. We use the same acupuncture points. But instead of using like one line down the body where the line might go from the head to the toe, we'll use a bunch of different lines, points in a certain area, right? So the shoulder, maybe we'll use, 8 needles around the shoulder. And the goal is, once you get those needles into the directed areas and you hook the electric up to the needles, is you get a lot of movement out of the muscles, so you're getting a good pumping action, and you get a lot of blood flow there, right? We're kind of going not backwards, we're coming full circle in the medical community where we're figuring out again that nothing heals better than your own body, right? So we're trying to get away from medicine, and the whole goal of anything we do or any orthopedic doc's procedures that aren't just repairs is get blood to the area, blood keeps those like good cells around that have the
Right.
healing properties, and then that can fix the issue by itself. You might not need cortisone. You might not need, you know, these things that have side effects. So,
Right.
so that's what dry needling really does. It's just get a lot of blood flow into the tissue and around an injury so that it can set yourself up to heal.
So then it necessarily like they don't hurt, or there's still amount of pain
yeah,
to people
it's-
that don't like needles, or
Yeah, it's way less than any typical needle, like, or shot, right? Because it's a really thin needle. Some areas you don't feel a thing. Things like the foot or the hand, you'll feel a little more because they have a lot of nerve endings. But stuff like the back or the shoulder, you might not really feel much. People are usually surprised when they see the needle, and then you put the first one in, and they're like, "I didn't even feel that one." So it's not always painful, but some areas do come with some pain. Yeah.
Okay. So, you know, with things that are big now and some developments like pickleball, and a lot of people get injured playing pickleball, even bocce. So do you go out and do seminars for, like, you know, big developments that have, you know, like a lot of bocce players, a lot of pickleball players?
Yeah, absolutely. Yeah, we've had them in the office. We've had a few. We did one for specifically pickleball. People come in, we do a presentation on like how to prevent the injury. If you do get injured, what to do. We do seminars on, you know, a lot of things. We'll do them at the local high schools. We'll do them at the senior clubs. And just for us, it's just like education, and then be in people's minds if they do get hurt. And pumping to the public that you don't need a prescription to come in for PT. If you get hurt on a Thursday morning, we could get you in typically by like Thursday afternoon, right? And so you don't miss any time in the healing window, which is huge on the outcomes. So we try to get that across to people, and try to give any things we can do to keep them out of here. But the reality is, if you're playing a sport, and pickleball is a quick twitch sport, there's going to be injuries, right? You got to pay to play. So anything in life that's fun comes with some type of precaution.
Some risk, yeah.
So we try to just be there for those active communities as much as we can, so that we can help out when they do get hurt.
Okay. So what could our senior community do, and I think you answered this in part, to help as they age, to help them deal with neuropathy, deal with all of the other things that come with age, arthritis, and you know, lack of movement, can't do stairs anymore, can't carry stuff anymore.
I think, and not just to be like everything's a nail when you have a hammer, but for the senior community, because physical therapy wasn't around when the senior community, who is, you know, let's say in the 75 up age group right now, when they were younger. So it's kind of unknown, but it really is the best thing for them, because to get on look, everyone needs to exercise, everyone. To get on a program for someone who's a senior who maybe hasn't exercised is like intimidating, very intimidating. They're not going to go to a gym, right? And they don't want to hurt themselves. So get in a PT office, right? Like, that's what we're here for, is to get you on. And it doesn't necessarily mean you have to spend a lot of time here, but we can check it out. We can see what the precautions are for any certain person and build a program around that stuff so that you're safely working out, right? So maybe you have an old arthritic hip that you shouldn't do big, long squat holds or something. And hey, don't do some squats, but here's a couple other things you can do to get your legs strong. So I think the senior community should utilize PT way more than they already do, and I think it's just because it's relatively new, and it's a thing that if the doctor gives them a prescription, they'll go, but otherwise they don't even know it's out there for them, you know. So,
or unless something happens where they have to have rehab,
right? Like you break something or you have surgery, So a lot of people don't even know it's here, but that's a huge population that we deal with. It's just people who want to get stronger. They want to prevent osteoporosis and arthritis, and those are the people I love getting, because you're getting at the injury before it even happens, right? So, and they're getting better. They're getting more fit. They're getting more resilient, and hopefully the big one is preventing falls. You know, falls is like the leading cause of death in the senior community. So we do a talk literally just on falls, on how to prevent them.
That's good.
Yeah. So it's one of the things we'll go out, we'll talk to, we did one at the Toms River senior community about falls and preventing osteoporosis. So get out there, move safely, and utilize PT and OT. Like it's there. It's covered by Medicare fully, so it's at your disposal. So
that's what I was going to ask.
Yeah. So use it. I would, knowing what I know, I would use it and abuse it. I would be in here as much as I could, but some people are just busy, so they can't
Right.
do that. But just keep moving is the main thing.
And do you take any other insurance other than Medicare?
We take mostly everything. Yeah, Medicare is the easiest because it's just a federal. You're either in with it or you're out with it. We're in with it, and we take all the usual commercial insurances, auto accidents, workers' comp stuff. The only thing we don't take currently is Medicaid, which is for the lower income. But other than that, we take pretty much everything.
That's great.
Yeah.
Well, this has definitely been enlightening. This is a really good interview. You came up with a lot of good information.
Awesome.
That's definitely going to help our viewers.
Good. I'm glad.
So again, thank you so much for being part of my show today.
Thank you.
And this is Michael Blank, Heart of the Jersey Shore. Until next time.